My name is Alex. I am one of the educators for the community diabetes team, and we've got a few helpers as well in the room. So we've got my colleague Marie, who is a dietitian with us, and we've got Teresa, who is a specialist diabetes nurse. So any questions that want to come through on the chat, they'll be keeping an eye on those, and we'll be answering them at the end if that's okay, unless there are any burning questions as we go through. So what we're discussing today is what is diabetes and what should I look out for? So what somebody can be doing next if they start to experience any concerns with their health. So first of all, what is diabetes? So diabetes is when there is too much sugar in the blood. And that could be for a lot of reasons. That could be because of the food that we're eating. It could be how much food we're eating. And this happens when your body doesn't make enough insulin, or your body can't use that insulin properly. Now, insulin is really important because it helps us use that blood sugar so that we can be active. So it helps us feel really energized so we can do all of our daily activities. And remember, diabetes can happen to anyone, and there's lots of people who can help you stay well. And we'll talk about that in a moment. So there are a few different types of diabetes as well, and we'll talk about type 1 and type 2, and they are the most common. So to start with, both types might make you feel a little bit poorly. So it's really important that you go and speak to your doctor or your nurse, or you might speak to a family member or a friend who can help you as well. So type 1 diabetes can often appear quite quickly, and that makes it harder to ignore. So you might feel poorly and you might want to have a talk with somebody who can help you get that appointment really quickly. Type 2 diabetes is slightly different, and it can be easier to miss. And this is because it changes more slowly, especially in the early stages. So that can make it harder to spot the symptoms. So what does diabetes look like? It's important to remember that not everyone is the same. So your symptoms might not match those of another person, particularly if you know somebody that already has diabetes. So the most common symptoms to be looking out for are things like thirst, feeling quite tired, sort of having blurred vision as if you can't focus, needing the toilet a lot more, losing weight, and having slow healing wounds. So if you have a cut and it's not going away very quickly. So if you have any of those, it could be worth speaking to your doctor just to see if they can help. So what we would encourage you to do next is, if you have any of those symptoms, it is important to contact your doctor as soon as possible, and they'll be able to help you get the care that you need. What they can also do is invite you to speak to a dietitian who knows all about food and health, so they can help you choose the right foods to eat, and that will help you feel really well too. So what should I do to stay well? It's important to look after yourself so you feel healthy, and there are a few things you can do every day. That means eating healthy foods, staying really active, taking any medication if it's needed, and also don't smoke. So if you're a smoker, we can also help you if you want to cut down or if you want to quit. So let's look at those in a bit more detail then. So eating well. We want you to choose more of these foods because they can help you stay healthy and help you feel energized. So that includes fruit, potatoes, meats, fish, vegetables, cereals, beans or pulses, salads, eggs, milk, and hopefully nice tasty brown bread as well. So lots and lots of options are available, and it's about making sure that you eat a mixture of those. So food doesn't need to be boring. It's there to be really exciting, and it's there to be enjoyed. However, diabetes can be influenced by the foods that we eat. So we say be careful with some of these foods because they can make you gain weight. And these include things like chips, pies or pastry, crisps, any kind of added sugar, maybe in your tea or your coffee, fizzy drinks, fried foods, chocolate, cookies and biscuits, and any alcohol. So you can enjoy these as a special treat, but we say try not to eat them regularly, because as we've said, they can make you gain weight and maybe feel even more tired. We also want you to stay active. So gentle activity can also help you stay healthy. And there are lots of things that you can try. You could try walking, swimming, dancing, housework, and gardening. And we want you to try and aim for 30 minutes every day if you can. And that can be done in small chunks, maybe 5 minutes here, 5 minutes there. It doesn't need to be 30 minutes all in one go. It's important to remember that you enjoy that activity. So do whatever you find joyful, and that means you're going to go and do it again and do lots of it. So with diabetes, you will have a checkup, and that means you will visit your doctor or your nurse regularly to make sure that everything is okay. And they'll check a few things for you that will include your eyes to make sure that you can see and you don't need any glasses. They'll check your feet, your blood pressure. They'll check your urine and maybe your blood as well, and your diet. So all of that together will help you stay really healthy. If you're worried about any of those, you can speak to your doctor or your nurse before you have those done, and they will put your mind at ease. So please remember, you can still do all the things that you want to do and everything that you enjoy. And there are lots of people who can help you along the way if you need support. So remember to speak to your friends, your family, anybody that you might work with, and also your doctor and your nurse. And it's okay to ask for help. That's exactly what they're there for. So after that quick presentation, we have a few colleagues with us who can answer any questions that might be coming through. So Teresa and Marie, if you are there, I will hand over to you.
Hi, I'm Teresa. I'm one of the community diabetes nurses, and I'm here to answer any questions that you may have about diabetes. I noticed that there's some question about sort of identifying change due to communication difficulties. And again, with the carers, it's actually noticing how things may have changed with the person. Have they noticed weight loss, as Alex mentioned? Have they noticed that they're thirsty, or something simple like their pads need changing more regularly? So it's just sort of being aware of those potential changes.
I've asked that question knowingly, having gone around a number of homes and talking quite a lot to families, and we've had your colleagues talk to us from our health action groups, which is great to create awareness of what to look for and how to look for. And this is tend to be recorded on health action plans, especially within the learning disability world. But sometimes it's difficult for people who can't communicate. And yes, they can visually see the changes, but sometimes the changes aren't always that straightforward for those with complex behavior. Is there a way around that? Maybe pictorial images, perhaps, which we also tend to use Easy Read quite a lot,
yeah,
that people can actually be shown in a different way. I know it's educating as well, not just carers, but families as well.
Yeah, so there are lots of sort of facilities, and there's lots of information that's out there, and from those action groups, we've definitely seen that there is plenty of information. So it's sharing it far and wide, definitely.
Is there sort of any sort of recommend? I know there's a lot of diets and there's lots of things out there that could be used. Is there any sort of recommendations from your perspective, really, in relation to diets? And I'm thinking about the group that we work with, really, that's realistic, because very much they're set in their ways, as the care staff are as well. I'm not just talking about in homes, but also supported accommodation. Is there sort of appropriate diet plans that could be suggested that people could use? And also, what period of time would they need to be on those specific diets for noticing a difference, as well as going back to the GP for regular tests?
Okay, I think I should introduce myself at this point. Can everyone hear me?
Yeah.
Yeah, you can hear me. Can you wave if you can hear me?
Yeah,
Yes,
that's right.
Really, because it's always difficult to know. I'm Marie Orford. I'm one of the diabetes specialist dietitians, and I have the pleasure of working with Alex and Teresa. And if you want to use Diabetes UK as a resource, they've got excellent menu plans and suggestions and recipes, although it is basically normal healthy eating. If the whole population ate as we're recommending for people with diabetes, we'd all be a lot healthier as a UK population. So it is just normal balanced meals. We tend to promote what we call a balanced plate, where it's increasing the emphasis on having more vegetables on the meal. If you think of a plate and you divide it into quarters, and you have the equivalent of a half of the plate full of vegetables. Now, that may take a bit of persuading where some people are concerned. So a good way, and anyone who's been a mum with difficult children will know this, hide the vegetables in the dish or make them into lots of tasty things. So I'm thinking basic things like cottage pie, spaghetti bolognese. You can put an awful lot of vegetables into the sauce with the meat. So you're actually having less meat and less pasta and more vegetables in it. And encouraging whole grain things where you can. So instead of all white bread and white breakfast cereals, to have the whole grain ones, and encourage moderate portions, not great big mountains of it, so that the starchy bit of the meal is about the size of someone's clenched fist, as a very vague rule of thumb. So breakfast is a pretty normal affair. It's just not overdoing the starchy foods. Lunch and evening meal can be based on that balanced plate model. And there are lots of menu plans and ideas on Diabetes UK, but just remember, it's normal healthy eating. And a Mediterranean style diet is what is recommended for general health. So that's including lean protein, lean meat, and including some oily fish if people like it. And, you know, really upping the vegetables and including some fruit.
Yeah, that's great. That's sensible. Sorry, Karen.
Is it also about eating your meals at the same time each day on a regular basis? Or no, doesn't that affect the sugar levels?
It can affect the blood sugar levels. You know, we can't always eat exactly on the clock because a lot of things are happening in people's lives, but it's trying to get into a good routine where we're not chopping and changing and eating a huge amount at one meal and a small amount at another, and spacing food out throughout the day. It does depend on the medication regime, whether someone's on insulin, because you're wanting to balance the food, and in particular the carbohydrate eaten, with the action of the medication or the insulin. So you are right, Karen, it does make a difference, but there is some flexibility to accommodate within someone's lifestyle, you know, and you don't always have to have a hot meal. You might have a sandwich meal instead of a potato meal, for example. So it, you know, I can't stress more, it isn't an abnormal special diet. It's healthy eating that's nice and regular to balance with the medication. And quite often there is an emphasis on trying to reduce weight because that makes it a lot easier. It increases insulin sensitivity. It makes it easier to manage blood glucose levels if someone isn't carrying lots of extra weight. So balancing healthy diet with good activity as well, as Alex highlighted, and doing things that people enjoy doing, like dancing or playing team games or whatever.
Thank you.
And Karen asked about sweeteners. Marie, could you answer the?
Okay, sorry, I missed that on the chat. Well, there are several schools of thought about sweeteners. It's a bit of a difficult one. On the one hand, they can really support people in making easy transitions. For example, swapping ordinary Coca-Cola for Diet Coke, and swapping, fruit juices, which are high in natural sugars, if you want a long drink, for a sugar-free squash, which is an easy swap to do. But we don't recommend the bulk sweeteners like sorbitol, which is the sort of thing you get in diabetic chocolate, which we really don't recommend because it isn't a healthier choice. So we recommend, if you really want chocolate, have a couple of squares of ordinary, preferably the darker the better chocolate, and keep it at that. As regards the sort of downside of sweeteners, it doesn't always encourage people to lose their sweet tooth. So if you always have 3 sugars in your tea and you swap to 3 sweeteners, you haven't educated your palate. And there is some evidence that they may upset the natural bacteria in your gut. Now, that's not really very robust evidence, but we don't want people to be too reliant on sweeteners. We like people to move towards having a diet that perhaps isn't quite so sweet and sugary, and perhaps reducing the amount of sugar in recipes anyway, so there isn't very much in them. You can make a lot of things with far less sugar and get used to that less sweet taste, and then substituting 1 or 2 things in. So I hope that's kind of answered your question, Karen.
Yes, it has. Thank you.
One thing I did come across in a care home, which was quite interesting, the cook was trying really desperately to get everything right, and she'd gone on the internet and started using coconut sugar, which is just the same, and so is honey. And a lot of these replacement sugars might be the same. It's a good idea to look at the calorie value on sweeteners and use one that doesn't have a lot of calories in it if you need to use one, rather than one of the other sort. And certainly sorbitol will give you the runs if you have too much, because it draws water into the gut and it has all those calories that you don't need.
Thank you.
We've just had a message from one of our nutrition educators, Alicia, who's come on the chat to say there's some really useful information on the NHS website about general weight loss for people with learning difficulties. So that is really useful, because that often is a challenge, isn't it?
It is. It is very much a challenge. No, that's really, really useful. Thank you. Sorry, Karen.
Yeah, can I ask one question? With somebody that's already been diagnosed with diabetes, do they have, and they develop a problem, do they have to go through their GP to be referred to you, or can they come directly to the community team?
So it would depend on what they would need from us. If it's to get more information and speak to myself or one of the other educators, that person can self-refer. So that's all done online. We have contact details. You can speak to our administrator, so they could either do it online or they could phone or email the team directly. So that process is very straightforward. So a nice self-referral in to speak to myself or Alicia or Hannah. If it's specialist input from somebody like Teresa or Marie, that would need to come from their doctor. So they'd have to have an appointment with their GP first of all, and the GP makes the referral to the specialist team.
Okay, that's lovely. Thank you.
Thank you very much indeed again. I really appreciate your time today. And also we'll be in touch very soon.
That's great. Thank you, Simon. Thank you, Karen.
Take care. Thanks, Karen.
Thank you.
Bye.
Bye.